Desert Oasis Healthcare is proud to announce that Dr. Osmundo Saguil has been awarded the prestigious Physician of the Year award by the California Association of Health Services at Home. This award basically honors physicians who truly demonstrate exceptional dedication to home care, ensuring its vital role in the healthcare system. And here he is joining us now, Dr. Saguil, the Medical Director of Desert Oasis Home Health and Family Hospice Care. Congratulations on this award. I know it is so well deserved. Thanks for being here with us.
Well, thank you for inviting me, Bianca. Happy to talk to you.
Of course. Dr. Saguil, I know because I've had the opportunity to get to know you and interview you in the past, this is truly so personal for you and to you, what you do. It is more than just a job. Why did you get into home health and hospice in the first place? What did that start with?
Well, as I went through my training and my experience in the medical system, I found that there was a bit of a distance between a physician and their patients due to the complexity of the healthcare system we know today. So I started to appreciate that the most purest sense of how a physician deals with a patient is at home, because it's in their environment, they're in control, and there's no escaping it. You're going to be there and have to interact with patients. So as I went through my professional journey, I tried to see every patient encounter, whether it's at home or not at home, as if it was a home visit, so that I could connect well with my patients to improve their outcomes the best it could be, including their satisfaction.
Right. And I know there's often a stigma around the word hospice and what it is or what it isn't. What do you wish more people knew about hospice and home health?
I wish that people would understand that it's a life-affirming, they are life-affirming programs trying to improve patients' quality of life, no matter if it's towards the end or maybe not towards the end. Hospice does deal with patients who are terminal 6 months or less, and home health, however, deals more with patients who are expected to recover. But the most common misconception about hospice is that we're just giving up. And I like to tell people we're not giving up, we're giving more. So trying to focus it not on cure, but on the care that's needed, which always improves the outcomes in patients' comfort and their acceptance of their disease.
And I know as it is right now, FHC offers incredible care to its patients. Any hopes for the future, though, looking ahead when it comes to what FHC can offer, or just in general, what hospice can really bring to patients in need?
Well, I think there are a couple of ways to look at it. What I've always been passionate about since 2017 or so is trying to educate not just the healthcare providers, but the community in general. By community, I mean people who live your neighbors or people you see in the grocery store, trying to have them feel comfortable about these discussions, although as difficult as they can be. And I'd like to continue to expand that in the different avenues which we know today, particularly on social media channels, continue our outreach to community centers, or wherever we think we're going to make the biggest impact. But that's my wish for the future, is to really try to connect with patients and have it to be less of a topic you're trying to avoid, but something you want to engage in a positive way.
Sure, you understand, right? I could definitely feel your passion. It's very tangible. I have to ask before we go, and I know you're so humble, so you're, I don't know how much you're taking it in, but Physician of the Year, it's a huge deal. When you found out you got this award, take me to that moment.
Well, I was actually shocked because I'm just a person to work. I don't really, I guess I may not be that well known, except for people who work with me. But I was literally in the same office you see now, and then my administrator, Brian Michelson, kind of burst into the room. I had my door closed, burst into the room. So I said, "Oh my God, what happened? What happened?" He says, "You'll never guess what." So I'm like expecting something, terrible to come my way. And he says, "Oh, you got an award! You got an award! You got the best physician of the year!" And my jaw was like dropped, and I said, "What? How did that happen?" Well, they were plotting behind my back, I guess, to get me the award, because they do work with me, and they really appreciated what I do, which I appreciated in return. So, and the rest of the day I was smiling. Well, I'm always smiling, but I was red and smiling because it was a great award.
So deserved as well. I just want to thank you for all the incredible work you're doing, and with such compassion, no less. And I know we're also excited to see you get the award in May. Dr. Saguil, thank you so much.
Oh, thank you, Bianca.